Okay, we'll call the meeting to order. It was properly posted on July 19th. Is there a motion to approve the minutes?
I'll make a motion.
Second. This is a lot of minutes here. We got the May 18th, June 15th, and July the 3rd. Is there motions and seconds? All right, all in favor say aye. Aye. Any opposed? By the way, as a rule of note, I've been instructed to make sure that we have no opposed votes, so I'll be sure to try to do that, and if I fail, prompt me to remind me to do that so that we have a proper record.
I don't mean we can't oppose anything.
I know what you're talking about.
Council instructed that maybe no votes aren't being recorded, so I'll call for no votes, and if you don't utter no, then you'll be listed as a yes.
Well, of course, silence is consent.
No, it's not.
No, it's not.
It is, for me. Only time you can figure on me not agreeing, I'm gonna say something.
That's been my experience.
You're so shy when they press that.
All right, is there a motion to approve the special meeting minutes of June 6th, June 14th, and June 29th, and July the 12th?
Make a motion.
Second.
All in favor say aye.
Aye.
Any opposed? All right, 5 through 35. Consent doc.
Move approval of the consent items numbers 5 through 35.
Second.
All in favor say aye.
Aye.
Any opposed? All right, item 36. Danny.
Time out.
Oh, I apologize. I skipped over that. We need to have a motion to reopen item 32.
Motion.
Second.
All in favor say aye.
Aye.
There was a Scrivener's error. I failed to report that to you. It should be, Danny, do you want to talk about that or the next item? Okay, I'm sorry. An amount of $314,711.72 should be $205,000, $3.00. Is there a motion to approve?
I move approval as amended.
Second.
All in favor say aye.
Aye.
Thank you, Karen. Now, Danny. Oh, I apologize. Is there any no votes to that Scrivener's error? Okay, go ahead. Thank you, Willa.
You just don't like to think negative, that's what it is.
Following the law.
Following the law.
All right, the monthly report, if you would, turn over to page 1 of the report. The PowerPoint that you'll see up on the screen is also on the agenda, if you want to follow along there as well. The only thing I want to point out on page 1, this is a look at our final budget by department for general fund. Just wanted to point out that we ended the year with a reserve, balance of reserve of $1,750,000, which was more than we had projected. We had projected that we would end the year with about 1.4, so just to note that that's extra $300,000 will go into our fund balance for the September supplement. Flip over to page 3, still looking at general fund.
Excuse me, Danny, back before we leave that, obviously I'm very pleased with our amended budget down there where it shows a fund balance of $9.3 million. These numbers are now, these numbers are 100% actual numbers now.
Right, those are the budget figures that we ended the year with, that amended budget column.
That's the point, is every dollar in here now is in here.
Right.
Danny,
Yes, ma'am.
could you help me, please?
Sure.
My number 1 has about 8 people, pictures on it.
She's going by the page numbers.
Oh, okay, yeah, I'm not going through the budget book. It's it's the attachment that's on the agenda, the PowerPoint. Yeah.
All right.
All right. Page 3 of the monthly report. Look at general fund as of the end of fiscal year. We ended the year collecting revenue in the amount of $87 million. That's 107.4% of what we had budgeted. That goes along in lines with what we budgeted last year, where we had collected almost the same percentage of the budget. Good news there is when we built our budget for fiscal year 17-18, we had estimated that we would collect $85 million. So we collected about $2 million more than what was estimated. A big chunk of that is resale, that was put in from the treasurer's office of $1.4 million. So again, that will go towards the fund balance, which will help in our September supplement as well.
That's okay, thank you, that's okay.
Love you, honey.
Flip over to page 5, still looking at general fund, just comparing fiscal year 16-17 actuals to 16-17 actuals. We collected in revenue $2.9 million more than we did a year ago. That's a 3.5% increase, which is right in line with what we budgeted. We had budgeted about a $2.6 million increase, so it came in about 3.4% over and above what we had estimated. Expenditures, we have spent $70,958,000 to date. This number is going to grow because we're still having expenditures that will go against the 16-17 budget all the way through September. So, and also 10 days of the June payroll will be posted in July as well. So that expenditure total for the 16-17 budget will continue to go up. All right, let's flip over to the employee benefits page on page 11. We ended the year with a cash balance of $170,000 in the employee benefits fund. Just a note there that we, in medical and prescription claims alone, we ended up spending about $5.5 million more than what we had budgeted and estimated for the year. No new news there. You guys were aware of that as we went through the year. But the good news is, looking at July, we've got a full month of July's claims in, and to date, when you compare July of this year to July of 2016, we paid out about $1 million less in 1 month in medical and prescription claims compared to last year. Not sure that trend will continue, but hopefully we're on the right track there. Another note, we did receive in stop-loss reimbursements almost $2.4 million in refunds this fiscal year in 16-17, and we paid out a total of stop-loss premiums of $868,000. So we're in the positive net, about $1.5 million over and above what we paid in premiums this fiscal year. All right, let's look at page 15. I'll take that back. I did want to show you this graph here. It's still talking about employee benefits. This is a graph I've showed you a couple times this fiscal year. It's a 10-year look at our employee benefits plan. The red line is the expenditures. It's that top line. Blue line is the revenue that we collect, and the green line is the transfers in from general fund. You know, if this were your stock portfolio, this would be a graph that you would really like over the last 10 years, but this is a look at employee benefits expenditures. So, but hopefully that'll start leveling out with the changes that have been made that I know John's going to touch on here in a minute. And we've already started to see this first month of July that we've seen a reduction so far. So I'd just like to point out this graph that, you know, that the money we're bringing in premiums from employees, premiums from the employer side, is not keeping up with the expenditures. That's why, you know, over 10 years we've gone from transferring $1.5 million from general fund to $10.5 million to make up for that gap. So something to consider as we move forward. Maybe looking at the premiums, trying to catch those up with what we're actually spending in our plan. All right, let's quick look at workers' comp. That is on page 15. Just wanted to note here that we paid out a total of $322,000 in claims in 16-17. You compare that to a year ago, we paid out $632,000 in claims. So that's about a 50% reduction in claims in 16-17 compared to 15-16. So health and safety is doing a real good job in that department. The last slide I want to show you is not a slide I go over every month, but I do try to touch on it once a year. This is our debt service fund. This is the fund where we pay county bonds and the county judgments out of. For the fiscal year 16-17, we paid a total of $9.7 million in bond payments and judgments against the county. Of that total, $911,000 were for judgments, and $8.8 million were for bond payments. Two of those bonds have, yes, sir.
Is that judgment, is that this year's annual payment?
Yes.
Do you have a cumulative total, how much the balance is?
Of what we will pay out again next year, I do not.
Liability is at the moment.
I do not. I do not have that number on me, I'm sorry. I can certainly get that to you and send that out. We do have two bonds that paid off at the end of June, the 2002 Tinker bonds and the 2003 Tinker bonds. So those bonds, we've made the last payment, so those go away. So we're left with two bonds, the GM plant and the railroad bonds that are left to continue to pay. So, are there any other questions about the report?
No questions of Danny. Is there a motion to receive these report?
So second.
All in favor, say aye.
Aye.
Thank you, Danny. Now our county...
Any opposed?
No nays.
Thank you. Is there any nays? Okay, if not, the health department.
Good morning.
Morning.
Just to touch on what Danny touched on in regards to the trends going up. I spoke on this before, but I did a study on the 5-year basis compared ours to other plans, and we're under the national average compared to other plans on what our trend. It looks bad, but most plans go up 16 to 20-something% every year. So of course we're doing things to counteract that, and we'll keep doing that. Last year we had a horrible year, so I'm glad that's over. But I have some good news today on your flyer that I passed out. The first thing is our provider network change and prescription change. That's going really well. With 3,100 members on our plan, it's a big change. We fielded some calls, some issues, but it's been going relatively smooth. So we're really happy about that. And the really good news is we've received our first 2 prescription invoices under our new plan. And remember, we didn't cut benefits, we didn't reduce benefits, same benefits. And with 2 weeks into our new prescription plan, the prescription costs are about $178. Last fiscal year, we averaged $262 every 2 weeks. So that's a difference of $84,000 in 2 weeks. Hopefully that'll trend out well. The amount of prescriptions hasn't changed. We've had about 1,600 prescriptions filled the first 2 weeks of this fiscal year, same as last year average. So if this trends out the way it will, I know we're going to have higher weeks because a lot of people fill mail order drugs and they don't get them until every 90 days. So we'll see some costs go up. But if it trends out, it's going to be well over $1 million of savings without cutting any benefits. So that's pretty exciting. And I'm really keeping a track and tracking those weekly as we receive those prescription costs to let you know where those go. But it's looking very, very positive right now. And on the back page, I just broke it down and where our planned payments are going. As you'll see, everything's negative. Everything's good, very good. We're still paying claims this month that are incurred in our prior fiscal year, so there's still some run-out claims, but everything is way lower than it was last fiscal year. We're about $1.4 million under. And with Danny's numbers, 1.2. I say 1.4 because I go based off Health Smart's numbers, but we're doing very well. We have some big claims that are still pending from last fiscal year. We have about $300,000 in claims that are going to come through this next check register, but those are from last fiscal year, so we're looking really well on that side. And so far, Healthcare Highways has received about $40,000 in claims incurred in July, so they haven't received any huge claims, so that's good news. We haven't had any big claims come in yet under our new plan, so we have really all positive things happening. And then just to remind you, in the coming month in August, we have our annual health risk assessment across the county. We've been doing that now 5 years. Very important because each year employees, spouses take those tests. We get that data, personalized prevention, I'm well, and they track those really chronic conditions, diabetes, hypertension. We get to see how the overall population is and how their conditions are getting better or decreasing. And then they also give those people, those members, they assign a nurse case manager to them to help them with their conditions. So it's been really a positive thing, but those are happening across the county next month.
Questions of John? If not, is there a motion to receive his report?
Second.
All in favor, say aye.
Aye.
Now talk to us about the heart hospital.
Heart Hospital, there's no changes. This is just a renewal agreement.
Oh, sorry.
Sorry.
Was there any nays to his report? Okay.
No changes, just a standard renewal agreement.
All right. All in favor, say aye. Or you gotta have a motion, I guess.
Motion. Second.
All in favor, say aye.
Aye.
Any opposed? Okay, now talk to us about advanced surgical and research.
Sure. This is a new contract and very excited about this opportunity. Heart Hospital offers us some cardiovascular services, but not a wide range. And as you know, those services can be very expensive. Dr. Dwayne Smith with Advanced Cardiovascular is here to speak on this contract, but he's one of the founding people of the Heart Hospital. But what they've offered us is some really great prices, great quality services for our most expensive stuff. So they've opened up the door to a lot more services for our members at reduced cost for vascular services and cardiovascular services. And I'm going to invite him up to speak on it.
Thanks for having us today. Yeah, I was one of the original founders of the Heart Hospital many years ago when we opened in 2002, and that concept evolved in such a way that it really didn't create the paradigm in healthcare costs that I envisioned and thought it needed to. And over the last 15 to 20 years, as we all know, the cost of healthcare delivery versus the price of healthcare delivered to the payer has been on a divergent curve. And even in the facility that I was part of and started, I saw those costs and prices not be in very good conjunction as far as the growth goes. And so my partner, Dr. Melton, and I, a couple of years ago, decided that we really wanted to. We're sort of in the third trimester of our careers, but one of our missions is really to do something locally to start our effort in bending the cost curve in the services that we provide. This is what we saw happen 7-8 years ago with all of these high deductible plans coming into place. People were starting to seek preventive care and early prevention procedural care less and less because of these high deductibles, and so the access was limited by the evolution in the healthcare insurance market and the healthcare costs. And so what we started seeing, and it was sort of one of the thought leaders in the area, was Keith Smith at the Surgery Center of Oklahoma, who's a good friend of mine. We realized that there wasn't an opportunity for cardiovascular in more of a free market environment. So Dr. Melton and I started this entity, and we've been in operation now for a couple of years with our outpatient clinical services. We've been open about a year with our surgical and cardiac intervention facility, and it's a facility where we can do procedures at 30 to 40% of the cost of a big box hospital with a lot better personal care, a lot more one-on-one, and more attention to the detail of the patient and the patient's family. And so we're excited to present this as an option for the county, and we've already been very successful in several other direct contract relationships, and we are very enthused to move forward with you folks, and would like to ask any questions you might like to ask of me. I'd be happy to answer.
This is a personal question. Does somebody who thinks they may have issues with their heart come to you for verification?
Absolutely.
Okay.
Of course, I'd have to defer to John on the process, as far as
Sure.
Going through the channels to make sure that there's mitigation of out-of-pocket costs and all of that.
I believe you mentioned, Doctor, that you were involved, or perhaps still are involved at the Oklahoma Heart Hospital. You talking both the one on the south side on 240 as well as the one on the north side?
The one on the north side is the one that opened first. and I have admitting privileges and do work at the one at the north side. The one on the south side is too far to drive to be, for me personally.
Okay. I noted in today's paper that, Mercy is going to build a new hospital down on the south side by that Oklahoma Heart Hospital.
That's correct.
Why don't some of you medical people consider the east side, since this is where the illnesses probably are the most in 73111, and it appears to me that when we get these wonderful things that come to Oklahoma City, they bypass the area where it's needed the most, where people by and large can't get there. Is there anything on earth you can do to help our less wealthy citizens?
Well, I would address that by saying that we take care of, I have been traveling to small communities throughout the state of Oklahoma for 29 years and providing services for Medicare and Medicaid patients throughout the northwestern, central western, south central, and southeastern Oklahoma for those 29 years. So in my experience, it's more about the quality and the relationship rather than the drive distance. And, you know, a lot of those patients that come to see us are not wealthy, and they will drive from 100 miles away to see us in Woodward if they live in a long distance away. So travel distance is less of an issue than the relationship. And so through the years, what we've tried to do, or my mission has been to create access, and access is more than availability than travel distance in my experience for most Oklahomans. The facility that is on the east side, the I-35 Integris and I-35 Mercy facilities, they are nice facilities, but your point is extremely well taken in that the out-of-pocket cost for seeking care at some of those places is substantial. And, you know, you can only do so much as one individual, and we had to make a decision about where we were going to build our facility kind of based on real estate costs and access and things like that. The good news is where we are located, we are just right off of Memorial and just to the east of Portland, and so it's very accessible from the east side of Oklahoma City. I live towards Jones, and it only takes me about 15 minutes to get to work. So
I'm just thinking about those folks who aren't able
I understand
to drive, and there are no buses that go to your hospital.
Yeah, thanks for your question. I appreciate it.
Thank you.
Further questions of the doctor? If not,
Wait a minute. I'm not beating you up. I just want you to know that. I'm not beating you up. It's just my job as a policymaker, no matter where I'm sitting, is to bring up those kinds of things. It has nothing to do with you, and I absolutely appreciate you and your partner for getting involved in this thing, and then you're offering your services to us. It's not at you, it's at the system.
I understand. I'm flattered by your question.
Thank you.
Thank you.
if there is to be action taken on this item, it should be noted that there's a Scrivener's error. It should reflect July 1st, 2018 through June 30.
No, July 1st, 2017 through
Through June 30, 2018. Okay.
You looking for a motion?
motion to correct.
Yeah,
With that correction, I think a motion.
I'll move that motion. I'll move that with correction.
Second.
Okay. All in favor say aye.
Aye.
Any opposed? Thank you, Doctor. All right. Mr. Skuda, do you want to?
Mr. Chair, I move that we strike for this month item number 40. I've talked with the sheriff, and there is nothing really that they have to report this month, so I'd move to strike it for this month only, item number 40.
Move it. Second.
All in favor say aye.
Aye.
Any opposed? Augie, you want to give us a report?
Morning, everybody.
Morning.
This coming this coming month in August, we're gonna have Maureen Jelinek come back out to, assist Danny in financial with, getting the year-end closed, so we can, start the new fiscal year. We reached out to our account rep, Brian Blair, who is going to get a schedule for refresher training for payroll, because we've had some new people in payroll, so we're gonna have a refresher training class. And, we're gonna try and get an experienced implementer out here, because I know we've had trouble in the past with people who've come out here that haven't been all that experienced in the Tyler product, so we're gonna try and get an experienced implementer out here, and Maureen recommended someone, Will Barnes, so we're gonna work on getting him out here so that we can get going with the refresher training with payroll, and they're working on sometime in September, so I'll let you guys know if that changes at all. As of July 1st, District 1 has switched over totally to using Munis work orders and inventory, and is just using Oracle and highway costs to reconcile costs for last year for the GASB and all that. And, a big shout out to Tex. He's been a huge help getting this, working in Munis. Yeah.
Go on.
Oh, okay. He's been a great help, and, we're working now. I was out at District 2 this past Monday, and we're getting District 2 up and going on work orders and inventory too. There's new people out there. I've worked with Jolinda, and there's 2 new people, Jason and Michael, so we're getting them exposed to work orders and inventory there too. And I'll probably go back out there with Tex for additional training with work orders and inventory. A couple of reports, working with Jolinda to get, a work order activity sheet for them out there, and I did a rewrite for Danny on the liability report, and we got that working. So that's kind of everything right there. So.
Questions of Augie?
No, I was just showing off.
Oh, yeah, Tex has been great. Yeah,
okay, is there a motion to receive these reports?
Motion.
Second.
All in favor say aye.
Aye.
Any opposed?
Thank
Cody,
you.
Thank you. Our BET report.
Good morning.
Good morning.
We really don't have much to report today. It's the beginning of the fiscal year. BET watch list has been updated, and you will see there is a lot of white on that sheet of paper right now. We don't have anything there. I'm sure that will change shortly, but I'd appreciate it if you'd keep it that way.
You don't work.
I will do my best to accommodate.
Thank you.
Any other questions of Cody? Do we need a motion to receive nothing?
So moved.
Second.
All in favor say aye.
Aye.
Any opposed? Item 43 is to appoint Doug and Volson and to the handbook committee, replacing John Wilkerson, and appoint Danny Lambert as the alternate.
Move approval.
Second.
All in favor say aye.
Aye.
Any opposed? Item 44 is interfund transfer for employee benefits in the amount of $500,000.
Move approval.
Second.
All in favor say aye.
Aye.
Any opposed? Board comments, County Clerk.
No, everything's great. We
Cool.
didn't move, I do have one comment. We, did move our, people from the corner office down. The abstractors are moved downstairs, and they're comfortable, and everything's fine.
Good.
Court Clerk.
No comment.
District 1.
Nothing, thank you.
District 3.
No, thank you.
Mr. Treasurer.
No, sir.
Mr. Assessor. Okay, any citizens to be heard? Seeing none, is there any new business? If not, is there a motion to recess into executive session?
So moved.
Second.
All in favor, say aye.
Aye.
Any opposed? Thank you.
Mr. Hooten, this is a beautiful document.
Ready to go back into regular session? Oh, if there is a motion.
Make a motion.
Second.
All in favor, say aye.
Aye.
Any opposed? All right, action on the remaining item. Is there a motion?
I move approval of the request.
Okay. Any further discussion? All in favor, say aye.
Aye.
Any opposed to,
Nay.
No?
Nay. You want to do a
do
roll
we need a
call?
roll call?
Yeah, let's do a roll call.
Clerk, please call the roll.
Yes.
Yes.
No?
Yes.
No. No.
Okay, declare the motion to have passed 4-3. All right, is there a motion to adjourn?
So moved.
Second. All in favor, say aye. Aye. Any opposed? We are adjourned.